Essential safety requirements presented by My Ibrahim Nursing Education Department. Defined as those medications which could cause an immediately life-threatening condition for the patient if an error in administration occurs. High alert medications policy and procedure identified by red labels. Verbal order and telephone order not accepted for prescribing. Storage at locked safety cabinet except insulin and heparin kept in the refrigerator in separate shelf and labeled. Independent double check by 2 registered nurse before administration. No abbreviation shall be used with the prescription of HAM. The nurse should follow the guidelines of IV administration from the pharmacy in the hospital data. Physician order should be clear, including the following information: dose of medication ordered, total dose of administration, rate of administration frequency, total course of therapy, no of doses, no OD days. Compare the label with the product in hand against the written order and medication administration record. IVI of HAM medications should be labeled. Documentation in MAR should be double signature with stamp. Concentrated electrolytes identified by orange labels. Kept in separate safety cabinet. Telephone and verbal order not accepted. Look like, sound alike, LASA, identified by green labels. Physically separated. Blood transfusion. Indications of blood transfusion: to increase blood volume after surgery, trauma or hemorrhage. To increase the number of RBCs in patients with severe chronic anemia. To provide platelets for those with low platelet count. To replace plasma protein such as albumin. Blood transfusion policy and procedure: to provide safe transfusion services to the patient and thereby optimum patient care in our hospital. Blood administration involves the process of informed consent. Preparation of recipient. Careful observation of the recipient during and after the transfusion for adverse reactions. All steps must be appropriately documented in patient file. Consent for blood transfusion. Prior to blood transfusion, the physician should obtain informed consent for transfusion of blood or blood products after educating the patient of all contents in the consent form. If the patient is unconscious or absence of guardians, the physician may sign the consent in the specialized space in the form. We have 7 forms in King Salman Hospital to be used for documentation of blood transfusion procedure. As you see on right side is patient education and left side consent for blood transfusion. Requesting form of blood and blood products. First, we need to identify the patient by 2 identifiers: patient full name, medical record number. The patient should be properly prepared, including insertion of large pore cannula or patent intravenous catheter. The staff nurse should fill up the first portion of blood transfusion monitoring form and bring it to the blood bank when blood is needed. Only 1 unit can be released at a time unless it is an emergent or large volume transfusion. Form of releasing the blood from blood bank. Request for blood donation to be sent for KSMC by the relatives. Signing out the blood unit from blood bank. Verified point name, ID number, patient's blood type and blood unit ID. Check expiry date of unit, ABO and RH type. Examine the unit for discoloration, gas bubbles, clumping of RBCs and particular matter. Pre-transfusion bedside checking procedure. We need to verify physician order. Blood transfusion should be checked at patient bedside by 2 registered nurse or a registered nurse and a physician before infusion. The patient should be positively identified whenever possible verbally and checking wristband. During transfusion, baseline vital signs should be taken and recorded. A standard blood filter must be used to remove blood clots and particles. Don't use the standard IV tubing set. The blood transfusion should be started within 30 minutes after receiving the blood from blood bank. Identification label from the blood bag shouldn't be removed until the transfusion is completed. Blood transfusion summary. It helps us to know how many bags patient received. In case of blood transfusion reaction, we need to do the following. First, don't be panic, reassure your patient, instruct the patient to report what he feels. Stop blood transfusion. Flush normal saline. Notify the physician and follow his order regarding management of the patient. Notify the blood bank to begin transfusion reaction investigation. Transfusion reaction form must be filled out and forwarded to the blood bank. Remaining of the blood with IV set will be sent to the blood bank with blood sample and urine sample from the patient to be investigated by blood bank. This is the blood reaction form that you should use in case of reaction occurs. Don't forget to take it to the blood bank with remaining of the blood. Don't attach the IV set from the bag. Thank you. Hope you listen again and again. Happy safe patient care.